Thank you, Mr. Chairman. Mr. Chairman, my amendment would protect our nation's most critical, leading edge, and relied upon cancer hospitals from the Medicare reimbursement cuts that Republicans are proposing in this package. These cuts and the precedent they would set restrict access to cancer treatment for thousands of patients in my home state and millions of patients across the country. For decades, Congress has recognized the unique and essential role of cancer hospitals in treating patients following a cancer diagnosis and providing hope for families, which is in part why they have a different payment system in Medicare. These 11 dedicated cancer hospitals across the country are singularly focused on treating cancer patients, including rare, complex, and advanced stage cancers, and serve over 1 million patients annually. They also lead thousands of clinical trials and operate at the forefront of technology and new therapies. The Fred Hutch Cancer Center in my home state of Washington is one of the leading cancer and biomedical research centers and is the only dedicated cancer center not only in Washington state, but across the entire Pacific Northwest. Fred Hutch serves roughly 50,000 patients every year, including over 8,000 patients at the Overlake Cancer Center and Evergreen Health Community Clinics in my district. Most of Fred Hutch's services are performed in an outpatient hospital setting, including some of the most complex treatments, such as bone marrow transplantation and CAR-T immunotherapy. Mr. Chairman, I ask unanimous consent to enter into the record a letter from the Fred Hutch Cancer Center highlighting the unique function that dedicated cancer centers play in treating cancer patients and spearheading cancer research.
Without objection.
Thank you. 10 other dedicated cancer centers across the country would be harmed by these cuts, such as the Moffitt Cancer Center in Florida, Memorial Sloan Kettering Cancer Center in New York, MD Anderson Cancer Center in Texas, and other life-saving cancer centers in Ohio, California, Pennsylvania, Massachusetts, and elsewhere. In the past, this committee has come together on a bipartisan basis to exempt cancer hospitals from broad-based Medicare payment changes. This situation should be no different. We should maintain this important precedent. I urge my colleagues to support this common sense amendment to protect cancer care and research and improve the underlying bill. I yield back.